Hello, everyone. Welcome back to another episode of The Root of the Matter, the oral connection to disease. I am your host, Dr. Rachel Carver, and I'm very excited today to welcome Joette Calabrese, who is an expert in homeopathy. And this is a very complex topic that I'm hoping Joette can kind of break down into the basics for us so we know kind of what to have on hand, how it can be helpful for certain tooth situations. In my practice as a biologic dentist, I don't like to give out a lot of prescription medications or antibiotics if I don't have to. And I know a lot of my patients who come to me are also always asking for those. Are there alternatives? Not to say that we can never use the medications, but there are other ways to support our body. So Joette's going to teach us today all about that. So welcome, Joette. Thank you so much for taking time to educate us today.
Well, and thanks for inviting me, Rachel. This is going to be fun.
Absolutely. So why don't we start with, the basic. What is homeopathy?
Yeah, well, it is a specific kind of medicine. Most people think it means holistic. They think it's synonymous with the word holistic, but it is not. It is not what naturopaths use or functional MDs generally speaking, unless they've studied this specific medicine. It is based on using little white pills generally. They all look alike, but they're all manufactured separately and individualized. And there are a couple different ways, actually, or there are many different ways to use homeopathy, but the way that I use it is what I call practical homeopathy, which means that we determine what the condition is and its corresponding symptoms. And then we use a specific protocol for most of the conditions and symptoms that people suffer. So what is it? Let's go back a little bit further. It uses homeopathic medicines, which are completely natural. They're not synthetic. They're manufactured by homeopathic pharmacists, and it's a dilution process in which we are using a substance that matches the symptoms or the name of the condition specifically. So it's there's more to it than that, of course, but I don't want to get too deep into it because it can throw people way off. It has been suppressed for a very long time. It's been around since the late 1700s. It started in Germany with Dr. Samuel Hahnemann, and it grew in great numbers all throughout Europe, the US, South America, especially India. And it was one of our most common forms of medicine up until about the 1940s in the US, which is when around the time the Flexner report came out and reports to subdue, I'm putting it mildly, I'm using a euphemism here, to subdue its ability in the market square essentially, and to get the petroleum-based medicine and surgical procedures to flourish and to minimize homeopathy's effect on society. But then in the 60s and 70s, it started to come back round again, kind of a little bit underground, but now it's having another flourish. And we're seeing a real shift in the way people are thinking about using homeopathy because my focus is I'm myopic about this. I want to teach professionals, mothers, grandmothers, farmers, veterinarians. I want to teach people how to use this in the simplest form ever. Because homeopathy has also taken a turn for becoming complicated or complex, esoteric, and even new age. That's not what I teach. I teach how to use a specific homeopathic medicine with the potency and the frequency, how often to use it for a specific condition and its associated symptoms.
And I can attest to Joette's teachings. They are very straightforward. She has a bunch of, different courses and things you can take. And because it is a very kind of complex science, right? Knowing exactly which medication to take, what proper dosage. I really appreciate her teaching for somebody like me who's super busy, as learning stuff all the time.
Yeah.
But I absolutely agree with you that every mama bear needs to, know these things because when we start our child off on the right foot, kind of avoiding some of the conventional treatments that may not be necessary in those first few years, right? We all have to remember that the child's immune system isn't fully developed till almost 3 years of age and obviously continues to develop all through life.
It's a very tender time, and we
It
should
is.
not be injecting and smearing and popping and rubbing and ointments. We wanna keep that child as pure as we possibly can.
Yeah.
Yeah.
I mean, the science is really clear. You're not going to read about it. You're not going to be able to find it, but the science is clear that when, we give the body what it needs, versus all these interventions, kids grow up to have much healthier immune systems. Like you can't refute that. It's hard to find the evidence, but it's there. It goes back to that whole Flexner report and, the powers that be that try to suppress the things that are really natural and effective. But there's, like you said, there's this resurgence now where people are demanding
Yeah,
these type
it's
of remedies.
growing.
People are sick and tired of taking a pill to fix the symptom from the previous pill, right? And you know, I see it every day in my
We've had
practice.
enough.
Yes,
We've had enough, and people are
everything.
turning around and by the tens of thousands, I'm seeing it in my social media and in people who are joining our academy and and our study groups. I The numbers are exponential. I never would have expected this.
Yeah.
There was a time back 40 years ago, 38 years ago, when I was having my first child and I would talk about homeopathy and I could see people's eyes glazing over. Now they're going, tell
Yes.
me more.
Yeah.
Tell me, do you have something for this? Do you have something for that? I got this. My child's got that. My mother, my dog, etc. Yeah, it's growing in popularity
It's
exponentially.
really and tell me a little bit. So, now we live in a world where we have over 100,000 chemicals, right, in the environment. We're spraying, and I mean, we can't avoid them anymore. Have you seen homeopathy change? Some people might say, "Oh, it's not as effective as it once was because of the onslaught of so much toxicities." Or is it just that we may need more or different dosages? Have you seen that changing
No, I've
trajectory?
not seen that the responses are different because of the chemical exposure and the food exposure and the previous drug exposure. What I do see is that it might complicate the case a little bit more. It might be a little deeper embedded, but even then, sometimes it amazes me. We give someone who's had many drugs and been exposed to the wrong kinds of foods and all the spraying on the foods and maybe they lived in Love Canal in New York State.
Yeah.
They may have been exposed to all of that, and yet a couple of doses of a particular homeopathic medicine sometimes can free them of that. Other times, it can take quite some time. It can take months, maybe even many months to a year to undo some of the damage. But it's really, when you think about it, we've been suffering from these. It's just more, to be honest, I think it's more of an awareness now more than ever. We didn't hear about microplastics, I don't know, 5 years ago. And now we hear about it. And we didn't hear about crops that were being genetically engineered until about maybe 5 or 10 years ago. But they were still being used.
Yeah.
We just didn't know why the person was as sick as they were.
Exactly, exactly. So let's talk to some of the mamas and grandmas and people who want to have a basic kit. I think if we're thinking about little kids, right, we want to what's the best remedy when you see that kid they're starting to get a cold or something. Are there some basics? Maybe talk
Yes.
about the basics that everybody should be aware of and maybe have in their first aid kit.
I love this question, Rachel. Thank you for asking this because I think it's so important. A cold, let's say someone gets a cold. I would urge people to get combination medicines that are made by well-known homeopathic pharmacies such as Boron, Boiron, or OHM Pharma, or Washington Homeopathics, or Helios. These are pharmacies that manufacture combination medicines, and one of them might be called Cold Calm or Cold Reverse. Or find those homeopathic medicines and keep them in your purse, especially if someone in your family is prone to this. And the moment they start saying, you start administering it. So that's not all homeopaths feel this way. I feel very strongly about these combination medicines. They have saved many a mom, including myself, from the severity of a cold getting much, much worse.
Yeah, absolutely. And I've used all of those remedies. I think they're fantastic. And I travel with a little kit of
Yes,
my
ma'am.
homeopathics. So, and
Yeah.
I love there's a little insert in there, depending on the symptoms, because that's another thing too when you're thinking about certain remedies, because there are different forms of a cold, right? Maybe it's just the runny nose or is it the sore throat? So the way homeopathics kind of work is based on the symptoms, right? And a lot of them, as you were describing, these are natural products. Like it could be a plant, right?
100% natural. There's nothing synthetic. They're not owned by anyone. They're manufactured in a homeopathic pharmacy, but they are very inexpensive
Mhm.
and they do not own they've not gotten something bastardized it and then sold it as something that's close enough but not quite with all the side effects. No side effects to these medicines.
And that's another thing that I love, about this, why I like things like ozone in my practice,
Yeah,
olive oil, coconut, all these things are natural. Your body recognizes these things, right? Our whole body
yes
are
it
made of
does.
energy, right? We've talked about this on the
Yes.
podcast a million times.
Yes.
Everything in the world, it's all energy. these different homeopathics are the frequency. And it's not, you're not even really ingesting the substance. It's been diluted so much that what's left is that frequency, that energy that your body recognizes, and it's turning your body back on, right? This is why I love
Yeah,
these
turning
kinds
it
of
on.
remedies.
I love that. That's a nice way of putting it. Yeah, it stimulates the body's natural ability to correct itself because we are always in the state of homeostasis looking to correct. That's what a fever is. If a fever is left alone and you just give that child lots of water or bone stock or even homemade popsicles and keep them hydrated, they'll get past the fever. No need to treat it. Now, if you must, if you're very concerned, there are homeopathic medicines that can be used for that. But I think a fever is curative. And we're talking about a childhood, a natural childhood's disease. I'm not talking about a fever after a head injury in an 80-year-old, something completely different. But if a child comes down with a fever associated with a strep throat, even strep throat, my friends, otitis media, conjunctivitis, all of those kinds of infections, by all means, let the fever go, let it cook it off. That's really the best way to go.
So this is a really important topic that people really need to
Is
understand, right? The fever is a natural reaction. This is the same thing. It makes me think of, when people talk about autoimmunity, that the body's gone awry. Like, no, no, the body is brilliant. It knows exactly
Yes,
what
it
it's supposed to
is.
do. So you
Yes.
get a fever, right? It heats things up. Think about, if you have bad water, right? What are you supposed to do? You're supposed to boil it off
Cook
so
it
you get
off.
rid of all the
Cook it off.
infection. Well, that's exactly what a fever is doing. It's boiling
Yes.
off the
Yes,
infection.
ma'am. Yes.
Now, right, you got 105 fever, you may be concerned. But again, our first thought shouldn't be to go to the Tylenol, right? There's so many. If you read the side effects of Tylenol and all the
Tylenol
possible
side
consequences,
effects.
it's really bad. And the more and more
Yes, it is,
evidence is
and it causes asthma, and sometimes it can cause asthma of the first event right then and there within hours of being administered to a child, and it can cause asthma, not just that one attack, but continuous attacks after that. Tylenol is not safe.
no, it really isn't. But we think of it so benign because, that's everybody gives it all
Well,
the
because
time.
it's been marketed to us for
Yes,
so
right.
long.
See, same thing, like, what about a pregnant mama, right? Really wanna be careful
Yeah.
when we're pregnant, and that's another area, right, where some homeopathy can be beneficial, right,
Yes,
to
it
avoid
can.
these other kind of drugs. So we kinda talked about fever a little bit about a cold. Let's say, what about a headache? And again, they can come from many different things. What are some, maybe just a couple really helpful remedies for headaches?
Sure. Well, I can give you homeopathic medicines that are specific for headaches, especially certain kinds of headaches. But again, I can also tell you to go to one of those remedies, those companies that manufacture I can't remember what it's called, headache free or something like Boron, Washington, Helios, all of these pharmacies come up with OHM Pharma. These are great pharmacies that manufacture these. By the way, this is indeed regulated by the FDA. The FDA, I just have to say this parenthetically, Rachel, because it's so much fun. The FDA was begun in the 1940s by a homeopath to protect homeopathy. So don't let anybody ever tell you that it's not, that we are not protected by that, well, protected by our FDA. We wish that they were more protective, but no, it is indeed regulated by the FDA, these medicines. So going back to a headache, one of the more often than not, you're going to have visitors to this podcast that are women, because the women take this is very important to them, and how to take care of themselves and their children and their elderly mother and the dog, etc., and their husband. So more often than not, especially if the headache is related on any level to hormones, such as she's just had a baby or she's on birth control. That's tinkering with hormones. Or if she's going through menopause, or she finds that the headaches are associated with her menses, or she's coming into menarche. She's a young girl coming into menarche, and now the medicine often is sepia 200 every 7 days. Now, that's for someone who has headaches on a regular basis, because obviously you're going to need another couple doses if it's happening right now and you need an answer. But this is for long term care. If there's another kind of headache in which this is the SOS, we got to treat it now. She's really suffering. Then we might use a remedy called picric acid 200 and belladonna 3. Now, that would be fabulous if you could order those, and you can get them on Amazon from Boron, Boiron, or from Dr. Redowek. And there are a couple of good pharmacies that actually sell on Amazon. And I have a love-hate relationship with Amazon. I think we all have, right?
Yes, absolutely.
If you're in a bind and you need to get these medicines right away, and you know that this migraine is going to last for 3 days if you don't do something, then you might want to use the overnight button and get it, within a few hours or so. So it's picric acid or picricum acidum. That's the full name. 200. You got to have that number after it,
Mhm.
and it's taken simultaneously with belladonna 3, and you take that every 15 minutes for the first hour of the headache, especially if it's a migraine. Now, then after that, we carry on and use it every couple of hours. But if after the first dose you're better, don't take it. If after the third dose you're better, don't take it. If you're still not better after the fourth dose because you've used it every 15 minutes for an hour, then you can carry on and take it a little bit further. And I'm not going to tell you that this is for everyone, because if I were to open up my repertory here and look up headaches, I would find pages and pages of homeopathic medicines that could be used. What I'm doing right now is I'm trying to extrapolate the most common
Yes.
way of treating something like a migraine. And by the way, I have to give credit to the Banerjees, Doctors Banerjee, who taught me picric acid belladonna when I spent years with them in India. And it's something that is so these kinds of medicines where they're combinations like this, and learning how to use them specifically for a specific condition is something that's exactly where I'm taking homeopathy. Instead of making it esoteric, I want to make it as simple as I possibly can.
Yeah, it's so important because again, there are so many different remedies out there and all different strengths, So you'll see if you go to order something, you can order in a 6C, a 30C, a 200C. So again, with Joette's all of her courses and stuff, it breaks it down. There's some good, sites that you can look up stuff to. And again, I'm really familiar with all those companies, except the Helios one. I haven't used those, but the other ones, and again, very, like you said, on Amazon, super easy to get very, very quickly. So maybe like what would be your top 5 ones that you would keep on hand at all times?
Well, it is specific to your lifestyle. So I'm in my 70s, and so I think of injuries, an acute respiratory infection that might come on very hard and fast. I think of potential cardiac arrest. I think of potential vascular event such as a stroke. And so then my top remedy that I keep in my purse for myself and my husband and my contemporaries is Aconitum napellus 200. Now, it's otherwise known as aconite or aconitum, or it can also be known as Aconitum napellus, which is the full word. Now, if instead, when I was raising my sons, I had arnica on me at all times because they were falling from trees and they were getting into skiing accidents and they were chasing after the goats and tripping over a root and hitting their nose. And so arnica montana was the medicine that I had on hand at all times, in my purse at all times. Arnica montana 200C. Now, I also have to say, given that this is a dental podcast, I want to also say that if somebody has an extraordinary fear, I mean, it is over the top fear of going to a dentist, one of the best medicines is Aconitum napellus. It is also for a forthcoming anxiety ridden event. We have others too, but if it's really extreme, by all means, I have had to take it a couple of times before I've gone to the dentist. Actually, not a couple of times. I just take one dose just before,
Mhm.
like, or the night before. If the night before is the time when you're starting to think, "Oh my gosh, I can't handle this. I could die. This is really serious." And we keep going down that pathway that frightens us to the point where we're thinking, "I could end up dying from this. This could really be my demise." That's a call for Aconitum napellus 200C, one dose.
That's good to know. Makes me
Yeah, that's
feel
a good one. That's a
my
good one.
my nephew, he had last summer, he had a tick on him, and so his father, his mother, myself, we're all just kinda trying to pin him down to get that little thing out, and unfortunately, like, we didn't pull it out easily, right? So we were digging and digging. The poor kid, I mean, he is 4 years old, like, screaming and crying. Right after that, I gave him the Ignatia because those kind of things, right, are very traumatic. In a
Traumatic.
young person, that could
Yeah,
change his
yeah.
whole nervous system forever and
Yes,
ever and
it
a
could.
day.
Keep him from sleeping that night or for the next 3 weeks
Yeah,
even.
and so
Yeah.
Ignatia, that's a kind of a neat remedy to, like, try to reduce trauma, like, reduce that trauma from being embedded into the tissues over a lifetime, right? So, sometimes those little traumas and every time, he got a tick bite or a bug bite or something, it could trigger in the nervous system.
Yeah, yeah.
So, I like,
It could keep him from
Ignatia.
sleeping, he could be overwhelmed, so Ignatia, like Saint Ignatius, Ignatia 200C And you could give it right then and there, like you did so wisely, Rachel. But this is also a great medicine for mothers or anyone for that matter who's overwhelmed, especially by there's too much to get done. My nervous system feels frayed. I don't know if I'm going to be able to get to sleep. In fact, I'm not sleeping very well. And I have fears and worry, worry, worry. Ignatia 200. And generally, we use it when it's more chronic like that twice daily for just a few days until we see an end to it and then we're done. And then once it's done, this is the beauty of homeopathy. If that symptom or those symptoms, that cluster of symptoms return, instead of saying, oh, no, it's back again. Instead say, hallelujah, it's back again. I know exactly what to use. I simply go back to the last medicine that acted so well, homeopathic medicine, reinstate that Ignatia again, Ignatia Amara, 200C, twice daily, and within a couple of doses or a few days, it's melted away again.
Well, I can't say I know anyone who feels that overwhelmed feeling who might be listening to this podcast.
I
Like,
can't imagine that either. Who could that
yeah,
be?
like, okay, let me pull some of that one out right now. That's
Right.
awesome. So now let's segue into the whole dental piece there. So I love that. The aconite. We've used like the rescue remedy from Bach, but I'm like, oh, I always have aconite. I was like, that's a great, because I don't like to give my patients anxiety medication if I don't have to. Right? Then the
Right.
sedation effect, they have to have
That's
somebody
just
drive
one
them.
more drug that has to be cleared.
Exactly, and then, then they have to get a ride and, it just complicates things and it just feels unnecessary to me. So we have crystals and pulsed electromagnetic frequency mats and gems and you name it. So that is definitely something gonna add to the bucket there for sure. So let's talk about like some common tooth pain. So you have a toothache, right? And so there are kind of two forms of toothaches, basically. One where it's like I feel it kind of here versus the abscess tooth where like it's this one specifically. So if you have that, and as a biologic dentist, I'm always trying to avoid the need for more invasive treatment, right? How can I avoid the root canal? And again, as we were talking about, everything in the world is energy. When you have pain, in my experience, that's telling me that there's some form.
Something's wrong.
Right. And there's not the energy can't move properly, right? And so I'm always thinking,
Needs
how
to
do
be
I
addressed.
increase the energy? How can I, you know, how can I fix this without having to be super invasive with, any kind of drilling or, other kinds of medication. So if you have that, what we call like reversible pulpitis type of pain, where maybe it's hot,
Yeah.
cold sensitive,
Yeah.
what would be a couple remedies you might choose?
Well, so let me just mention this parenthetically that just this past Monday, I did a Monday Night Live, which I present for free every Monday night, of course, on Facebook and Instagram, and it shows up on YouTube. And it was on the fact that I had 19, number 19 extracted. 19 is not a small tooth, as you well know.
That's a lower
And
first
I had it
molar. Yeah.
yeah, yeah. It's a big one. And that night I got it extracted at 3:30 in the afternoon, and that night I presented what was done, how it was done. And then after I did that Monday Night Live on Facebook, it's Instagram, etc., I went on and then taught another class that lasted 2.5 hours. So that's a test, and I'm in my 70s again. So it's a testimony to homeopathy. So let me just tell you this, that particular situation, and I urge your viewers to go ahead and watch that. But that it was extracted. I could have gotten a root canal. I did not want a root canal. I did not want that because I know that that can be a real bugaboo, can really cause trouble later on in the future, and you don't even know what's going on. But at any rate, it was a fractured tooth. It had gotten infected. I knew it was infected. I mean, I know I'm a homeopath. I know what the symptoms are, and I knew it was infected. But no matter how I use the homeopathic medicines, I could help clear it only to a certain point because it was being reinfected by the mere fact that it was fractured. So I did have it extracted. And so then I was dealing with not only the angst, but also the extraction itself, any bleeding afterwards. These are all different medicines. But oh my gosh, they're so easy to use and so pleasant to use. Then there was the local anesthetics, more than one. I think I had 4. But after a while, who's counting? He's counting. I'm not counting. I don't want to remember. But at any rate, there's that. Then there is the infection itself. And then there was afterwards, I had a little reaction, I believe, to the local anesthetic. But that didn't come until days later. And then, of course, the pain. There's no doubt there's going to be pain once the anesthetic wears off. Now, the anesthetic did wear off. I mean, all of this, all the numbing was gone. And that's how I ended up presenting on Monday Night Live and teaching it all because I was using Hypericum 200C. And I used it regularly. I didn't just take a dose. I took a dose about every hour. And I could tell when I needed another dose just around 50 minutes after the last dose, 55 minutes. It was almost like clockwork. I needed another dose of Hypericum perforatum is the full name, Hypericum. It's St. John's wort, only made homeopathically. So some of you may know it as St. John's wort. And I took that frequently, and I'm still taking that. Now this has been 10 days. It's been about 11 days now, and I'm still taking it not for pain. I no longer have pain. Now what I'm taking it for is the infection, which is much, much, much reduced, but I can still tell there's a little sense of an infection there, and I have to get rid of it completely so that, I don't have osteomyelitis and I don't get the bone doesn't get infected.
Yeah, I like to use, so with our practice, we're using lasers, try
Yes,
to
ma'am.
avoid too much drilling because that really
Yep.
affects the bone, negatively. So with
Yes.
lasers, with ozone, we use the PRF, which we draw out a little bit of your blood, spin it down, use the platelets. There's a lot of good, healing stem cell
Yep.
materials in there. And then I always, before the patient leaves, before the numbness wears off, I'm always giving them an arnica 200C.
Yep. 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 That arnica is really important for the trauma, for bleeding, to make sure it clots properly. That's very important. We want it to clot properly. We don't want, obviously, we don't want to clean it out too extensively that night after we've had some, our bone stock instead of macaroni or something.
And interestingly, one time, when I had a patient that was had a badly infected tooth, we were able to clean it out. I gave her also Hepar sulf 200C. And interestingly, like a few days later, she broke out with almost like a viral. And I was like, ooh, I don't think she needed that. Like that maybe was what we call
So
proving.
Rachel, what I do for that, if it is a soft tissue infection, a boil, a gum boil, or it's still not gotten to the root of the bone, then I use Heparsulf 6.
Mm, yep, too high of a
A
dose.
200 is too was is just it's just a different potency, but Hepar sulfuricum calcarea is the whole name for that remedy, but it's known as Hepar sulf 6 for a gum boil or any soft tissue infection. That's why when people ask me, "So what can I use for my dental infection?" I need to know more. Is it on the bone? Or is it in the bone? Is it on the root? Is it a soft tissue? Is it both? So, and that will determine which homeopathic medicine would be best chosen for that.
All right, let's
Yeah.
let's circle back to that pulpitis, that inflammation in the tooth. What would be your favorite remedy for that?
So when you say inflammation, do you mean that the tooth is still integritous?
Yes. Yes, it hasn't died
Hasn't
yet, so it's still
it hasn't died yet.
it's
Okay. And so
symptomatic
now they're
hot cold.
sensitive. The tooth is simply sensitive.
Correct.
This is a good one. You're going to love this one, Rachel. For sensitive teeth to hot, cold, sweet, etc., is mesoreum. Mesoreum 2C. Now, what mesoreum does is it deals with the with teeth that are sensitive. And if you use it and it doesn't do enough, then there might be something else going on that's more than just sensitive teeth. There could be something that has gone to the next degree, maybe hasn't been seen yet on the x-ray.
Mhm.
You haven't found it yet. So Mesoreum 200C, it's a beautiful medicine twice daily. And we don't take it forever. We use it it's kind of a testing and to see whether, okay, that pain's better. Okay, it's still improving. Okay, good. Now it's 4 days. Okay, still good, still there. But we can carry on until it's nearly zero. Then we stop. We don't carry on. These are not supplements or vitamins where we take them forevermore because we're assuming that we're not getting the right nutrients. No, these are medicines, specifically medicines, just not synthetic and without side effects.
Exactly.
But they are medicines that are specific for a specific condition. And once the condition is pretty much resolved, then we back off.
And now let's say you take the wrong remedy. You chose the wrong remedy because again, it can be complex there. Is there a negative impact? That's what I'm wondering. Like when I gave her the Hepal sulfate and she got like this viral, I was like, ooh, I don't think that was the right remedy. And it actually caused, the viral, it resolved itself quickly, but I was like, I think, she didn't need that. Obviously the dose was wrong too, but I also thought,
Yeah, yeah, yeah. It was really whether it's the dose, it's the remedy, the potency, or the frequency. Any one of those that can be off can make a difference too.
mhm,
So there are two ways to look at this. One is choose the next medicine based on the suffering that she's got now. The best antidote to a poorly chosen or an incorrect medicine is the correct medicine. So that's one way to look at it.
mhm,
So what you could have done had if you'd known about Heat Self 6, you would have gone, "Oh my gosh, I used the 200. I took the wrong one. Oh, it's the 6. Okay, now we go to the Heat Self 6."
mhm.
So that's one way to do it. But let's say it doesn't become clear what we do next. then we can simply use camphor or camphora,
Mhm.
200C, 1 dose. Sometimes a second dose is needed a few hours later. And that often antidotes a poorly chosen or an incorrectly chosen, not only homeopathic, but even the ailments from synthetic drugs. We can also halt a lot of the side effects from synthetic
I'm
drugs.
glad you brought that up because I think that that's super important. I forgot about that one, but it almost like resets, right? It's like,
Yeah,
oops, okay, let's
yeah.
start over. Let's
Yeah, yeah,
it
kinda
helps to clear.
cleanses and
Mm,
yeah, clears the case. That's right,
yeah,
that's right.
yeah, awesome. So that's another good one to kind of always have in your kit,
Yes,
just in
ma'am.
case.
Yes,
Like,
well, especially for you, because in being in practice, you're treating many people, and you wanna just have that available. Yeah.
what about something else that I've used over the years? We're always thinking, let's say you have a young child, they're starting to have a lot of excessive demineralization. We want to try to halt before it actually cavitates and creates a large cavity. I have so many mamas come to me like, it's just starting. What can I do? And for a long time, I was trying to use cell salts. Maybe talk to me about, is that good? What would be something you would
Oh, I
choose?
think you're right on the mark there. Yeah, cell salts. So what I well, a couple of things. I think I hope that it goes without saying, but it's certainly worth mentioning, and that is nutrition. It is so important. It is so important, and I urge mothers to get a hold of the book "Nutrition and Physical Degeneration" by Dr. Weston Price. It's a photo essay of children and how they've grown and their teeth and the width of their palates and how teeth grow. It is Nutrition and Physical Degeneration by Dr. Weston Price, which was written back in the 40s. I mean, so it's 80 years old now, this information, and it was stellar information. And every dentist in medical school studied many of his works, probably not this particular book, but he was a prolific dental writer. He was a dentist and he wrote prolifically for the dental industry, and his works are still held in high regard. So nutrition, no doubt about it. Raw milk, high quality, good raw cheese, bone stock, homemade soups. So that's what we're talking about. Eggs, 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 fried in butter, 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 butter. So let's start with that and eschew all the oatmeals that everybody called heart healthy and the cereals and all that business. No, 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 no. We finally flipped that around in the government. Those of us who've been in the holistic world for a long time have known, no, no, supposed to be eating breads and pastas and oats all day long. That's for when people are starving. No, no, no. We need the high animal proteins and the correct fats. So let's put that aside and go to the homeopathic medicines. And you're absolutely right, Rachel. It's Calc Phos 3, which is a cell salt, silica, I use 6, and calc fluor 12. And they can be mixed together in water and put in your child's glass of raw milk or in a glass of water, and they melt practically immediately. And you give that, especially when they're already on their way to getting some decay. Then I would use it 3 times a day and use it for long periods of time.
Yes, I think this is, and what I love about these, again, they're teeny tiny little lactose and they dissolve easily. So it's so easy for a child. You're not forcing your 3-year-old to
No,
swallow a
they don't
capsule
bad tastes or anything. They don't
or
have to swallow
drink
it. Just
something.
no,
My kids
right,
are always like,
right,
ah, yeah, I don't want to drink anything, but they
right,
will take homeopathic, no problem. And that's
right.
why I always travel with them, because I'm not carrying all my supplements or anything. Like this is just
Yeah.
a no brainer. So that's really important. And I'm glad that you really brought that up because on the foundation of our practice is always that nutrition. We need to have those minerals, right? That we're getting in that
Yes,
blood
ma'am.
stock and the
Yes,
fat
ma'am.
soluble vitamins. Those are the two. And
Yes.
this is what Weston Price talked about. These were the main, kind of conclusion, right? That these people, these native populations who had these beautiful, strong teeth, beautiful, wide jaws, they had 10 times the amount of minerals, 4 times the amount of fat soluble vitamins in their diet. And that is just
Yeah.
absent, right?
It has been absent. There's no doubt about it because if we're following the standard American diet, it's oatmeal for breakfast with some maple syrup. If they're lucky, it's
Yeah.
maple syrup, and I don't even think maple syrup's a good choice, but it's certainly better than I don't know the pretend stuff. And then when they get to school, they might have a chocolate milk. And they might have a graham cracker. Then lunch comes around and it's Lunchables, which is bread and overly processed foods, and then fruit, which is in moderation, it's not so bad. But now we've already really talk about insulin.
Yeah, right.
Now we're really spiking. We're really pushing that poor pancreas
And
and the
that's
liver.
what we talk about too, right? Those blood sugar spikes that causing those like
Yes, ma'am.
reactive oxygen species. I try to teach people that that is actually what changes fluid flow inside the
Yes, it
teeth.
does.
It's pulling those nutrients, right? We've got to to minimize that effect, right, on our internal organs. So we need all those minerals to dampen down that, or the increase the pH, right? All those foods create so much acidity in our body, and it's
Yes.
minerals that balance that. And if we're not getting them in our diet, they have to come from somewhere, right? So our teeth
Yeah,
and our
from
bones
somewhere.
are
That's
going to
right.
suffer.
That's right.
So
Yep.
so a lot of moms will come to me and like they feel like they're doing, everything right with the diet and the brushing and the this and the that. And I was like, there's a deeper immune system.
Something that happens every day. We really I can't remember who wrote this, but it was a little phrase that I actually have taped in my kitchen cabinet. We dig our graves with our forks.
Yeah, it's especially nowadays. It's really true,
Mhm.
and it's hard, when I've been practicing for 23 years now. I remember coming out of dental school, I was like, "I should probably specialize because cavities aren't gonna be a thing anymore," right? We fixed that with fluoride, right? That was my belief 23 years ago, and then I'm like, "Oh, holy crap, it is so much the opposite. It is so much worse
The
now
opposite.
than in my
Yep.
generation," and if fluoride was really the end all be all of preventing cavities.
We wouldn't have them just as you assumed. That's
No,
right. That's
no.
right.
So, no, we don't need that.
So now we're all taking the fluoride out of the water. Even municipalities are finally
Yes,
catching on.
yeah, yeah. So, beneficial. People are and I always tell my patients, right, fluoride, that's not a natural component in your tooth. But you know what it is? Calcium, phosphorus, all these minerals.
Yes,
That's
silica.
what we
That's
need to
right.
be
That's right.
putting
You're
into the
right.
system.
Boy, are we on the same page, Rachel? We've never met before, but we certainly are on the same page, aren't we?
Absolutely. It's so true. Because again, the body knows how to work. We just have to supply it with the right,
Yep.
foundations,
Yeah.
the right nutrition and stuff like that. So, what about for if somebody has gum disease, right? Bleeding gums or getting bone loss, is there any specific remedies you might, obviously this is a complex issue, goes to the immune system
Sure.
and these
Sure.
kind of things, a lot of toxins, but is there a remedy that you can?
Yeah, for those bleeding, swollen, receding gums, one of my favorites. It's not the only one. There are many, but there's one in particular, and it's exactly what you used last time. But heap ourself against 6X twice daily, or 6C, heap ourself for bleeding, sensitive gums. Bone loss, that can, of course, is related to the gums receding and all too. But bone loss, we wonder if if a DEXA scan were used, whether or not we'd see bone loss elsewhere. And I'm assuming that what you're talking about pretty much is for an elderly person, maybe in their 50s, 60s, 70s. I think elderly, the number for elderly is 65 plus. So let's say elderly, 65 plus. Then we'll go back to calic phos, which we used for the remineralization of the children's teeth. 3X or 3C is really best. Mixed with Symphytum, Symphytum 200. Calc Phos 3 mixed with Symphytum 200, and that's used twice daily. Now, I would not use that prophylactically because if you use a medicine that's not correct and you're assuming that, then it can cause, as you said earlier, oops, wrong medicine, I need to undo something. But if the person has pretty much osteo anything, osteopenia, osteoarthritis, osteomyelitis, any bone issues, that's Symphytum mixed with Calc Phos, and it does really good work over time. It's not going to be immediate. It's over time.
And what about, people who suffer from a lot of, TMD, the muscle pain, the joints, clenching, obviously that is multifactorial, has a lot to do with
Yes.
nervous system dysregulation also. Is there anything, like, that's really good for tight muscles?
Yeah, are you talking about, let's say, after they've come out of your office and their mouth has been open for a long period of time and they're saying, "Oh my gosh, this is awful."
No, I'm talking more about the person who, maybe clenches and grinds, like, constantly has
Clenching.
the
Yeah.
tight
Yeah.
facial
Yeah,
muscles.
yeah, yeah. Interesting. I talked about that last Monday night on Monday Night Live because that's exactly why my tooth fractured is because I'm a clencher
Okay.
apparently. And I mean, when I thought about it, I said, "Of course I am. I can even feel it during the day. I notice it." And I drink decaf coffee and it's only a small amount. And sometimes I don't drink any at all. So I was blaming it on the coffee, but I don't think it was. There are a lot of medicines for that. One of them is Nux vomica I talked about. But if there is TMJ or if there is pain here, whether it's clenching or it's from opening their mouths too much or from just joints in general that ache, because that is a very important joint, then we use Rhus tox, RHUS. Rhus toxicodendron is the full word, but Rhus, RHUS tox, TOX is the medicine that we often use, and I often use it in a 30 a couple times a day for people, sometimes a 200. But if they've had their mouth open for a long period of time, because they've had some dental surgery, then you would definitely use it in a 200 a few times that day, the day after, etc. Yeah.
So generally, would you say that for treating an acute symptom, we tend towards more of the 200, or is that too much of a generalization?
In a way, I could say that, but remember now that picric acid was a 200, but the belladonna was a 3. And if a child has an acute, high fever going into 106, then we would use belladonna in a 30. So I wish that I could make it more specific than that. Instead, what I say is depend more on these protocols that I give away for free on my blog, on my Monday Night Live, on my podcasts. I mean, people say, well, how do I know how to treat this? I'll tell you, I've been doing this on these podcasts and blogs and Monday Night Lives for over 14 years, every week. I've never missed a week on any of 'em. So, there's a lot of useful free information there that people can then glean and gather up their protocols, the medicines that they know will work for specific conditions.
Absolutely, and at the very least, sign up to be on the mailing list so you'll get the emails all the time, and she's
Yeah,
always
yeah,
talking about, specific things. So and again, the
yeah,
website's
thank you.
fantastic. There's just so much information. Even though I've studied this, multiple different people, but I still go to that. I've taken a bunch of the courses, so, yeah.
That's
That's why I
great,
feel like
Rachel,
I
that
already know you because I've been following
I
your work for so long. And I was
yes.
like, when you were doing all the Banjiri program, I'm like, I wanna go with her and, go learn that
Oh
that
my see,
clinic
people
sounded fascinating.
someone like you would really have gotten a lot out of it.
Yeah, because
Yeah,
again, that's
yeah.
my primary focus is always prevention,
Yes,
education, right? I
ma'am.
don't wanna have to pick up a drill, right? I want to have solved this
Right.
whole dental disease that,
Yes,
nobody
yes.
needs me anymore, right? That is
How lucky your patients are to have someone like you. It's hard to find people like you. There are a lot of dentists who call themselves biological, but not all of them are. Not all of them have your philosophy. It's philosophical.
it is.
It's down to your toes. You can see it. And that is really, really valuable stuff. I travel long distance to get to my
Mhm.
dentist. 5.5 hours when I'm up north, and I live in Florida now. And so we took a plane, took a whole day to get there and a whole day to get back, and stayed in a hotel. And I mean, it's a big deal because when you find a good dentist, my friends, don't leave. Don't look for convenience for someone who's only a few miles away. No, no, no. Go to the best because you only get one mouth.
Yep.
You only get so many teeth.
I know I travel very far for all of my I'm like, "I don't care."
You bet.
Like you, I'll hop on a plane because,
Yes, ma'am.
I want the best. I want somebody who shares my philosophy as well, right? That
Yes.
we're trying to, help the body heal itself. I mean, I had such horrible eczema for years, right? I
Uh-huh.
couldn't even hold my kids' hands. I couldn't bathe them. Imagine putting gloves on and off 100 times a day. It was just horrible. And, it took me over a decade to really understand the nuances, but that was, that's part of my journey to learn and to be able to give
That's
back
well,
now.
that thank goodness.
Right.
People don't come to homeopathy skipping
No.
along. They come in crawling. We have suffered to get to here,
Yeah.
to this point.
Yeah.
And why we've suffered at the hand of the prednisones and the antibiotics and the birth control pills and the hormone replacement therapy and the and I tell my students a lot of times, get a nice long sheet of paper and a pencil with a real sharp point and a good eraser and start writing down your life's timeline. When was the last time you got sick and what was the treatment? You know what I mean? Okay, you had pneumonia, but what antibiotics were used? And then go back 5 years before. Oh, you had that urinary tract infection. Oh, that's right. You had 5 rounds of antibiotics. Okay, now go back and go all the way back to your birth because unless you were born at home and there were no interventions, you had drugs or your mother did at that precious, blessed moment in time. And you put that all together, you'll start seeing a picture will emerge. And the picture that will emerge is that you'll say, oh my gosh, I willingly, we've all done it. Please don't let anybody get the idea that I'm blaming anyone, but we have all done it. My gosh, I said yes to this, and then far back here. Oh my gosh, when I was 15, and then I had all those teeth extracted for no reason at all, and then this, and then you realize, oh my gosh, this is the result of too much synthetic intervention and earth shaking interventions. So having, for example, and I know you know this, having wisdom teeth extracted just because. Well, you're of age, so you just have them extracted, and then what that causes afterwards.
Mhm.
Now, there's a time and a place for extractions, and I don't have to tell you that. But to just do it because you got to a certain age is absolutely ridiculous.
Yeah, it really has to be personalized. That's what we really focus on
Yes,
our
ma'am.
practice too. And like the whole idea of You have a cleaning every 6 months. You have X-rays once a year. Who came up with that? Like, we
Right.
are all
Yes.
so
Yeah.
different. Like, I had a new patient ask me yesterday, "Do you require X-rays every year?" I'm like, "Well, it depends on the person, right? You know, are you healthy or do you have a history of decay? We do a lot of saliva tests. Do you have the risk factors?" Like, no,
Brilliant.
it's
That's
just
brilliant.
we've gotta get away from these weird constructs of what health is supposed to be when each one of us is so unique. We
Yes.
cannot, you can't fit it neatly into these boxes, and so
Yes, ma'am.
our whole, perio gum program has completely changed recently because we're seeing the risk factors. Like, we don't want to wait 6 months. You've got a lot of risk factors that, there's these things are putting you at risk for heart disease, stroke, diabetes. Like,
Yes. Yes,
until
ma'am.
until we can see really rapid improvement, because now we have a microscope even, so we can see the bacteria in the mouth, even though it may look from the outside pretty healthy. We go take a plaque sample, we're like, "Oof," not, and again, right, the body's really smart. You're not gonna get a symptom until the body has exhausted all its
Has given up. Yeah.
right?
Yeah.
So we really wanna find those precursors before it's so much more expensive, right? And extensive and invasive to have to treat something versus
And scary,
yeah, all
and it limits our freedom, and it ruins our quality of life, or
absolutely,
can.
absolutely,
Yeah.
but it was
Yeah.
funny when you were listing all those things, I was like, "Check, check, check," right? So my eczema and people sometimes feel it felt like after I gave birth to my 2nd daughter, I all of a sudden got eczema, and I'd never had it as a kid. I had acne, but I was on all that stuff and antibiotics and you name it, and it was, then after having 2 babies back to back, my system was so depleted, right? I never restored it, and then had all the backlog of all that stuff that affected the microbiome, the liver, all
It
that.
matters.
It
It
does.
all
It
matters
does.
what we do. It's called iotrogenic, a disease that's caused by drugs or ill-chosen ideas, medical ideas, and boy, you so this is so refreshing to talk to you,
Which
Rachel.
is
It's
the
a
3rd
beautiful
leading cause of death, which is kind of scary, right? Is
Yes, it is. It
harm
is. I
caused
know.
by properly prescribed medications and procedures,
Yeah.
after heart attacks and cancer, right? That's
Right.
pretty scary,
Right.
and that's avoidable. Okay, so that's, again, that's why those of us who are sharing my philosophy, our philosophy, we are really just want to educate people to know that there are alternatives. We don't have to go down these paths,
No, it
and
Yep.
now with the internet at our fingertips, there's so much more. You know,
It's all there.
it's
It's all there if you know where to look.
Yes. Yeah, then it becomes overwhelming, sometimes. But that's why you have people like us there who we've done our homework, we've, done the education so you can, come in and ask us. That's why I really enjoy doing consults. I had one from somebody from Florida today, right? So the power of the internet, they
I'll
don't
bet
have to.
they travel. Yes, they travel to get to you. I totally believe that.
Yeah.
Absolutely. Yeah, it's worth it. It's
Yeah,
worth it. Yeah.
absolutely. Well, we have learned so much. I'm so excited now. I'm like, okay, I've got to restock up on some of these
Yeah.
great things. Is there any other remedy that, that you think is really valuable that maybe we haven't touched on yet?
Well, we touched on arnica, but let me also add arnica to a list of other symptoms that are very relatable. Arnica montana is a great medicine for injury before surgery. So if there's dental surgery before and or after, it's great during labor. It helps the woman. It helps the body utilize the helps the body clot properly. If the blood is too viscous, then it thins it. If the blood is too thick, then it makes it thinner. It corrects. That's the difference. These medicines are not manipulative, they correct. Arnica montana is also a great medicine for after any kind of accident, a car accident, also for not being able to sleep. It's a great insomnia medicine. And I often use all of these medicines in a 200, but it's also great for hemorrhoids and vascular conditions such as varicose veins. That's one of our number one medicines for that. Now we use different potencies for these, but I talk about all of this on my blog. I teach all about how to use these medicines specific for each of these conditions. And it is a medicine that definitely you want to have on hand. Now I mentioned it for my sons who are always falling from trees or getting, butted by a goat or something, but it's for so much more than that. I also have used arnica in water in a low potency like a 3 and put it in a spritzer bottle and sprayed it on eczema to help the itching. It often helps enough that it calms it down. And then we use other homeopathic medicines to uproot it, but it can be really, really calming for a very itchy eczema. And you use it regularly. Just keep that little spritz bottle right there and spritz it no matter where it is, on your face, behind your knees, in the flexors of your arms, etc. That's a great medicine for everyone to know. And it's a good place to start. These medicines we've talked about today are really a wonderful place to start. And then if you own those because you know you might need them, now you learn a little bit more about them. You go online and you look up these medicines and what they can do on a Materia Medica, which is an entire book that gives you information. But you can get these books online, not exactly this, but a book online for free, and read up on these medicines so that you become an expert in even just one medicine or even just one condition or one concern of yours. And if you're the one who's the worrier, learn about Ignatia 200C and start using. And if you find that helps you, oh my gosh, now you can give that to your sister and your daughter and your mother-in-law and the dog when you leave the house. And so then you become the expert in these medicines. But yes, Arnica montana is also one of my favorites.
Awesome. Well, this has been amazing. And again, guys, if this intrigued you, please reach out to Joette's website. Maybe tell us what exactly your website is so they can get all your.
Yeah, you just go to JoetteCalabrese.com. Joette is Joette, and then Calabrese, Calabrese.com. And then if you're interested in taking courses or something, then you go scroll down. It shows you Joette's Learning Center. It shows a little page there. You scroll down, and then I've got courses, online courses. But really, the thing that I love to see people use are all the free information that I give on the blog. And as I said before, I went through all of those. But also, we have study groups, and the study groups are amazing. And we call it Gateway to Homeopathy. And that's where you meet with others who are running these study groups, and you learn how to use these simple. You start little at a time, and then a little more information. And that's how you get started. That's how I did it, I don't know, 40 years ago.
Yeah, that was good for me. I really enjoyed, I had the traditional lectures by people, but I really enjoyed the study groups because you learn from each other and then you can call on
Yes, you
somebody
do.
like, what was that again? It was really
Yeah,
beneficial
yeah.
having that
You need
community.
each other.
Yeah.
We need each other. Women need women. Now, I'm not saying men don't do this because we do have occasionally we have men in the groups, but I mean, right now we're getting our enrollment ready for the Academy of Practical Homeopathy, which is a whole year-long series. It's much more intense. And we do have some men, but we have it's most of the students in this upcoming class are nurses or retired nurses because they've said, I've had enough. I've got to learn how to do this the proper way. I was in the trenches. He would prescribe the drug, or the other doctor, the female doctor, would prescribe the drugs, and I'd have to administer it. And I watched what was happening. These drugs were not helping. They were causing more trouble than I'd like to admit. And they said, and I got to get out of it. I can't do it anymore. And so that's when they come around and they decide, you know what? I think I'll learn homeopathy.
Yeah, yeah, that's fantastic. Again, one of the best things that I've learned has really helped me in my journey to help others. So I really appreciate everything you've done and everything you've taught me. So this has been a real pleasure for me to get to chat with you in person and help to educate our whole audience. So I encourage everybody to check out Joette's website, listen to this a couple times. There will be the transcript, so you'll be able to, see all the names of everything. So don't worry if you didn't have time to scribble it all down. Everything will be there. So, Joette, thank you so much for your time today. I hope everyone enjoyed this episode, and we'll see you on the next one.
Dr. Rachel Carver, thank you for inviting me.